Addiction and Cognitive Behavioral Therapy. Author, Mr. John Crimmins. Cognitive behavioral therapy helps people address problematic thoughts and feelings to overcome addiction. Be aware. Addiction, once established, is an enduring condition because of the powerful learning mechanisms it subverts. Addicts and their loved ones need to remain mindful of this in the years following treatment. 6 things about addiction. Addiction is a compulsive behavior. It can be hereditary. It is often coupled with other psychiatric illnesses. Addiction is a chronic relapsing disorder. Individualized treatment yields better results. Recovery is possible, and can take multiple attempts. CBT and substance use. Substance use is a coping strategy. Core beliefs generate automatic responses to triggers. When we do not challenge our thoughts, we maintain distortions. Cognitive distortions will exacerbate feelings, causing the person to use substances to cope. Challenging thoughts improves behaviors, which improves mood and modifies beliefs. Inaccurate beliefs about using drugs. Getting out of my head makes life tolerable. I am more sociable when I use. All my problems go away when I am stoned. I have no worries when I use. I need to be high. Smoking dope and smoking coke, you are rendered defenseless. The only way out of that hopeless state is intervention. Robert Downey Jr. Why drugs are addictive. Drugs such as alcohol, amphetamine and cocaine act as primary enforcers. This operates directly or indirectly through reward circuits in the brain. Some people find this difficult to resist. Emotions matter. When we experience negative emotions, drugs are very rewarding, as they are reinforced both positively and negatively. Treatment barriers. The possible effects of repeated setbacks. Client blames themselves. I am lacking willpower and I am useless anyway. Client blames therapist. You do not understand me or my problems and the treatment is useless. Ambivalence about substance use and change is normal and constitutes an important motivational obstacle in recovery. William Miller. Triggers for drug use. A trigger is a thing or an event or a time period that has been associated with drug use in the past. Triggers can include people, places, things, time periods, and emotional states. Triggers can stimulate thoughts of drug use and craving for drugs. External triggers. People. Drug dealers, drug-using friends. Places. Bars, parties, drug users' house, parts of town where drugs are used. Things. Drugs, drug paraphernalia, money, alcohol, movies with drug use. Time periods. Paydays, holidays, periods of idle time, periods of stress. Internal triggers. Anxiety. Anger. Frustration. Sexual arousal. Excitement. Boredom. Fatigue. Happiness. An important CBT concept is to teach clients to decrease their time in high-risk situations and increase their time in low-risk environments. Understanding cravings. Many people describe craving as similar to a hunger for food or thirst for water. It is a combination of thoughts and feelings. There is a powerful physiological component to craving that makes it a very powerful event, and very difficult to resist. Coping with cravings. Many clients believe that once they begin to crave drugs, it is inevitable that they will use. In their experience, they always give in to the craving as soon as it begins, which inevitably leads to relapse. In CBT, it is important to give the client tools to develop awareness and resist cravings. What is relapse prevention? Relapse prevention in CBT is a treatment with a focus on the maintenance stage of addictive behavior change. It has 2 main goals. To prevent the occurrence of lapses after a commitment to change has been made. To prevent any lapse that does occur from escalating into a full-blown relapse. Ongoing recovery. Building rapport. Teaching clients knowledge about addiction. Challenging distortions. Teaching clients about conditioning, triggers and cravings. Maintaining motivation. Teaching clients cognitive skills like thought stopping and urge surfing. Relapse prevention. Managing slips. Staying clean and sober. Learn more about addiction and CBT with our comprehensive diploma courses.